puts the onus on us to direct our own learning. We get to choose what we want to focus on, and I feel that it makes learning a lot more vigorous, personally for me, because then it's just immediately applicable to what I want.
One thing that's so exciting to me is that I get to do my subspecialty anesthesia starting in first year. So I've already done neuro anesthesia, vascular anesthesia. I'll be doing thoracic anesthesia as a PGY1. So when we do our call, we're set up for those on-call cases. We have that experience, and therefore we're able to practice what we've learned earlier on. So I think that we'll have more solid foundation towards our senior years and then again into independent practice. Our assessments allow us to really seek out opportunities to make sure that we see the things that we need to see within that block to be deemed competent. So I think it puts a lot on us to be self-assertive and advocate for ourselves to seek out those opportunities and those learning opportunities.
I think the biggest benefit for a resident with CBD is that it's going to be centered around them. The learner is the focus when we think about what we're trying to provide for education, and it allows them to be more flexible. So the resident who is able to excel and be able to proceed at a faster pace will be granted that opportunity through the transition to practice stage. Being a more learner-centered approach also offers the residents better expectations for what we want them to achieve, and that way they have specific stage of practice milestones that they can accomplish.
I think a real advantage to CBD, and something that I'm a little envious that the residents are going to have the opportunity to have, is the ability to look back at what they've done thus far. So right now, when I'm looking back at what I've accomplished in 4 years or what I've learned in 4 years, it's from my memory. I can look at the rotations I've done, but can I remember how many individual procedures, how many times have I seen this patient presentation? I think that's going to be a really powerful skill, because it's going to allow residents to self-reflect on their practice and their own education and say, I need to address this, I need to do something about this, I need to go to the sim lab, I need to seek out other opportunities, I need to, get online and watch videos and figure this out, because this is going to be really key to my future practice as an attending.
I think that the biggest benefit for residents of CBME is the fact that there's much more structure. There's more structure in the learning objectives. They're quite clear, I think, for the residents. And there's more structure in terms of guidance as to where to find out information, how to learn about different things. There's more structure in terms of the opportunities that we're providing to both teach, for faculty to teach the residents and for residents to learn.
The day-to-day training may not seem necessarily all that different for the resident. I think the resident is still going to have some academic training sessions, although I hope we're going to be moving away from a lot more lecture-based formats. In our current format, we have a lot of academic half-days, and I'm hoping programs are going to be more creative in the ways that they teach, so more case-based learning, more discussion-based teaching. So the residents are still going to have that. There will be didactic teaching. They're still going to have the same clinical exposure to patients in the clinics. The rotations will look the same, so a resident in my program, anesthesiology, will still see patients in ICU as they did before. But I think what's going to happen differently is that those residents on a day-to-day basis are likely going to have selected moments there where they will be evaluated using checklists or tools.
What I love about our CBD program is that I'm involved in an intensive anesthesia program right off the bat. So we start with a 3-month boot camp, which did a phenomenal job of setting us up for OR, for out of OR practice and independent call. So we really hit the ground running, providing a good foundation in our specialty. And then we had a good amount of time to really hone into our specialty and really develop those skills that we need. The simulation is extremely attractive as well. So we did a lot of simulation throughout our boot camp, common scenarios that we'll see on call, in the OR, outside the OR. So we had that confidence that I don't think we would have had otherwise in how to deal with situations, which I think is paramount.
One of the challenges that we face in emergency medicine is being prepared and competent in very, very rare procedures or the identification of very rare patient presentations. But that's really the fundamental core competency of emergency medicine. It's being able to pick out the needle in the haystack. When you're seeing 100 patients with the same presentation, picking up on those really smaller, subtle things that are going to lead you to diagnosing serious pathology and really helping the patient. CBD is going to allow us to kind of track what we've done, if we've seen this before, and to actually list and say, you know, I have not performed this thoracotomy in the emergency department during my training, but that is a core competency of an emergency physician, and I need to gain skills other ways to be ready for that when I do, or if I do, encounter that as an attending physician.
I think that they should expect more discussions, and I think that they should expect more honest, constructive feedback. Every resident, their goal is to be a good doctor at the end. There's no question in my mind about that. I just think that there's this stigma behind evaluation and assessment that negative feedback is a bad thing to get. But with CBME, constructive feedback is definitely going to be necessary to improve, and it's going to be that stepping stone to getting to the next milestone, which is that progression that they're going to want.
So the benefits for the residents, I think, are sort of primarily contained in the feedback that they get. So the idea behind CBD is they get a lot of feedback, they get it face-to-face, they get it close to the time at which they performed, so it's much more meaningful. And the idea is it stops people from unknowingly doing the wrong thing for a long time and thus delaying their progression to competence.
I think the greatest benefit that I can perceive from the resident side is that residents are starving for feedback. They want good feedback, they want to be told at the end of the day they did a good job, but they also want some specific things to work on. A great resident wants to hear, you know, I think you could hold the needle driver a little differently. I think that when you, said that particular word to the patient, they got their back up a little bit. Next time, could you say it in a different way? I think residents want to be observed doing their job. And what CBME is going to do, it's going to actually force our faculty to explicitly evaluate the residents and give them explicit feedback. I'm using the word explicit a lot because that's exactly what CBME is going to do. It's taking what we're doing implicitly and making it explicit.
For residents, the biggest benefit of CBD will be continued personal improvement. So the thing that I've found in our initiation of CBD is that you will be assessed more often, but that will become the norm and will become much more of a coachable moment for residents. And our residents have truly enjoyed that transition. And our residents find that they are much better surrounded by help to continue their improvement in their knowledge base.
We brought in the O-score, for example, and when we brought that into our program, and the residents, I think, were initially worried about it because they were initially worried that they may not perform, but they're not. If they're a second-year resident, they're not ready to graduate, and they know that. They just want the feedback. And they actually found that when we had that form of assessment there, they were actually given more room to show how they were doing, so that they felt that they were actually able to do more and given more opportunity to do more. So at the end of the day, assessment isn't necessarily a bad thing for the residents, nor do they have to be concerned about it. It is going to give them more feedback and hopefully more learning opportunities.
So there's absolutely nothing to be nervous at. I'm having so much fun in CBD, and I would not want my program to be any different. I talk to residents that are in PGY1 in anesthesia and other programs around the country, and where I'm at compared to where they're at is just like leaps and bounds. The confidence that I feel because of the skills that I've gained thus far in my program, I think are pretty outstanding. I have nothing bad to say.